Good afternoon, I'm Anthony Lugg with the Midday News. A special welcome if you're watching on onespotmedia.com. Up first this afternoon, to date, there has been no substantive word on the data breach which took place on the Jam COVID website, which is said to have exposed information of thousands of people who uploaded their information onto the website. It has left many wondering about the country's ability to protect one's data, especially with talks of making transactions with government agencies more digitalized. Cody and Barrett reports.
It was a scare for most Jamaicans and more travelers when it was revealed earlier this week that there was a data breach on the government's Jam COVID website. The website and app, built by the Amber Group, stored immigration records and COVID-19 test results for hundreds of thousands of travelers who visited Jamaica since June last year following the outbreak of the COVID-19 virus. The website was used for people seeking travel authorization to enter the island. Among the details that would be needed is signature, identification, and passport number. After identifying the breach, the National Security Ministry said an investigation was launched. According to U.S. online newspaper TechCrunch, the Jam COVID server contained more than 70,000 negative COVID-19 lab results and over 425,000 immigration documents authorizing travel to the island, which included the traveler's name, date of birth, and passport numbers. Health Minister Dr. Christopher Tufton was pressed on Thursday to talk about the issue. However, he was tight-lipped.
But for me to comment on a piece of an investigation or an incomplete investigation would, frankly speaking, be irresponsible and would also go against the course of natural justice. So I am saying that, hold a bit, the OPM has some jurisdictional responsibilities over the app and its application, as well as a number of other agencies, national security, health, and that's why there needs to be some coordination in determining exactly what transpired and how we can avoid it and how we cauterize any potential issues that may arise.
Dr. Tufton, however, sought to assure citizens and visitors to the island that data security is important.
We meaning the government, including the ministry, are very clear on the need to secure the personal information of those who use the app, and in particular as it relates to public health. We have had a long established tradition of confidentiality in terms of patient records. So more will be said on that in due course.
Cody and Barrett, TVJ News.
And Health Minister Dr. Christopher Tufton says an investigation will be launched into the management of the personal protective equipment PPE at the Bellevue Hospital in Kingston. This following complaints from employees who claim they have to be working without the gear due to lack of PPEs at the facility. The concern was put to Dr. Tufton at a COVID press briefing yesterday.
One thing we have tried our utmost best to do is to ensure that our frontline staff are properly equipped to do their work. And there has been periodic shortages, yes, but normally it's not a function of being out of stock. It's a function of just the management of the process, because central storage, movement, that sort of thing. So I will check on that to see if that is in fact the case. I can't imagine any manager telling a staff member to wash and wear a PPE, a mask for a month, you said, or something like that. I can't imagine that, because that would be very contrary to what is the standard procedure.
The total expenditure associated with the government's response to COVID-19 now stands at more than $8.4 billion. That announcement by the Permanent Secretary in the Ministry of Health and Wellness, Dunstan Bryan, on Thursday. O'Shane Masters has more.
More than $8.8 billion has been made available to the Ministry of Health and Wellness to boost the government's bid to reduce the spread of COVID-19. Of that sum, $8.4 billion has already been spent. According to Permanent Secretary in the Ministry of Health and Wellness, Dunstan Bryan, roughly $2.9 billion was transferred to the 4 regional health authorities.
We have also expended approximately $1.8 billion on drugs, and another $672 million on medical equipment. and supplies. And this is where you talk about our PPEs and other sort of sundries used to support the delivery of services.
Approximately $380 million was transferred to supporting agencies that work in tandem with the Health and Wellness Ministry.
The Ministry of Local Government, the National Solid Waste Authority, those agencies that are critical to supporting us in our work. There's been an amount that has been transferred, approximately $379 million or $380 million approximately, has been transferred to those agencies to assist the Ministry of Health.
Additionally, spending was done on almost all Type B hospitals across the island. Mr. Bryan said COVID-19 incentives and other allowances have been paid to the tune of $686 million.
And public education advertisement of $189 million have already been committed for all of the public and behavior change communication strategies that we have undertaken since the beginning of our experience with COVID-19.
In the meantime, the government will utilize some $6 billion to fund the new vaccination program, up from the $2.9 billion that was initially outlined. O'Shane Masters, TVJ News.
The People's National Party is to return to court on March 1 to answer questions into the Trafigura matter. The scandal was brought to the fore in October 2006 by then opposition leader Bruce Golding. The case hinges on the PNP government accepting $35 million from Dutch firm Trafigura Beheer to trade Nigerian oil on the country's behalf. Now, under Dutch laws, it is illegal for Dutch companies to provide funding to political parties. The National Public Prosecutor's Office of the Netherlands has been trying to get information on the matter since 2007. However, to date, there has been no information forthcoming. The matter went to the Supreme Court on November 15, 2011, and the court held that the proper administration of justice demanded a hearing in open court to which members of the public have access along with the media. The appellants, however, appealed to the Court of Appeal, and on June 23, 2017, the Court of Appeal dismissed their appeal. The appellants have since appealed to the Judicial Committee of the Privy Council, which is slated to hear the case on March 1. Now, those named in the case are former Prime Minister Portia Simpson Miller and former Cabinet Ministers Philip Paulwell and Robert Pickersgill, as well as Colin Campbell and businessman Norton Hines. And it's now time for a break, but stay with us. More stories when we return. Welcome back. Continuing the news. The number of COVID-19 related deaths in the country continues to climb. This as the virus claimed 7 more lives yesterday. Epidemiologist at the Ministry of Health, Dr. Karen Webster-Carr, gave an update on the status of COVID-19 on the island at a press briefing last evening.
Jamaica now has a record of 20,581 COVID-19 cases from 190,681 tests and 7,156 active cases. This as the country recorded 294 new cases yesterday among persons between ages 63 days and 90 years. COVID-19 related deaths have increased to 391 from 384 in a 24-hour period. The virus claimed 7 more lives. According to epidemiologist at the Ministry of Health, Dr. Karen Webster-Carr, majority of the confirmed cases are among females, but males are more likely to die from the virus. Similarly, when looking at the impact of COVID-19 on the different age groups, Dr. Webster-Carr says there is a higher percentage of cases among persons between ages 20 to 39, but people ages 70 and over are more likely to die from COVID-19.
Persons who are older are more likely. So persons who are greater than 90, there's a 1 in 4 chance. Persons 80 to 89, 1 in 7, and 70 to 79, 1 in 10. Among persons who have died, 98% had one or more comorbidity or risk factor, with 72% were over 60 years, 56% had cardiovascular disease, mainly hypertension, 44% had diabetes, and 14% had chronic kidney disease.
She says the Jamaica positivity rate continues to increase. Manchester, St. Catherine and Kingston and St. Andrew remain the parishes with the largest number of cases over the last 2 weeks. However, St. James, Trelawney, Manchester and Kingston and St. Andrew have the highest positivity rates.
Almost every community in Jamaica has been identified. So we know every community has been affected. When we look at the top 20, Old Harbour, Spanish Town, Mandeville, Gregory Park are the communities that has the highest number of cases.
A total of 253 patients have been hospitalized with the highly contagious virus. 22 are moderately ill, while 21 are critically ill.
The actions by the government for further restrictions, as was announced a week ago, to my mind are justified, and we want to urge Jamaicans to continue to observe those protocols to the extent that you are, and those who are not, encourage you so to do.
Cody-Ann Barrett, TVJ News.
Motorists and business interests in Montego Bay St. James are calling for urgent attention to be given to roadways across the second city. They think because tourism has slowed down due to COVID-19, the city's roads have been forgotten. Javon Keys reports.
These craters along thoroughfares in Montego Bay St. James, all too familiar to motorists who encounter them daily.
Over 2 years now, they fix part and left part. When rainfall, we can't go through a big deep hole. Mash up the whole of the front end. You understand? From when we beg people, every minute, we see them carry 2 and a sand control in it. Man, as rainfall, everything leak out back.
And the whole of my front end leak out. I don't know if the rich folks to fix it or the government to fix it, but some fixing to go on. Make we can have a better role.
Pedestrians also have their own obstacles to encounter, with manholes and depressions in the sidewalks, hazards waiting for a misstep or a slip. President of the Montego Bay Chamber of Commerce and Industry, Janet Silvera, said it's full time something be done about the roads.
We can be in a pandemic, but we don't have to look like we are suffering under a pandemic. And these roads are a disgrace. We're talking about craters that have been sitting there for months and no one is doing anything about it. The parish council, or should I say the municipal council, says that it's not their road. It belongs to the Montego Freeport Limited.
She says attempts have been made to get information on when the roads will be fixed, but to no avail. Ms. Silvera also says that persons have been injured by the manholes in the second city.
Those manholes have been left uncovered for the last 5 months. You want to tell me that nobody in authority has seen a reason to cover them? The fact that you have people who are blind, people who are old, people who are just not going to see it once they're walking down St. James Street. Then when you go on Barnett Street, which is one of the most popular streets in Montego Bay, the craters that are on that street, it is disgraceful.
Community Relations Officer for the National Works Agency NWA, Janelle Ricketts, says they are working to fix the roadways.
We have a patching program valued at just under $10 million that targets several roadways, including the Alice Elimaya Drive, sections of the Howard Cook Boulevard, and also the Barnett Street. These are just a few of the roadways that we have been targeting as part of ongoing efforts to repair several roadways across the parish.
Ms. Ricketts also says work is being done to replace the missing manholes. She was not able to give a timeline. Javon Keys, TVJ News.
In news overseas, as power is restored across Texas after a week of devastating outages brought on by freezing temperatures and winter storms, the state is confronting a major water crisis. Bursting pipes are destroying homes and water systems are crippled, with nearly 13 million Texans under a boil water advisory. More from the CNN.
The majority of Texans have their power restored, but survival mode is still in full effect. Many still don't have running water. Food supply now running low. Texans struggling after a week of extreme winter weather.
We are in a bad situation and it's getting worse.
As power is slowly restored across the state, new crises are emerging.
We were just so relieved to finally have the power on for a little while, and then our house is basically destroyed.
Overwhelmed water systems prolonging the misery. Leaking pipes are pushing the water supplies to the brink.
Right now, our big problem is drinkable water.
Nearly half the state's population is under a boil water advisory. Food also in increasingly short supply as grocery stores lost power and icy roads impacted distribution.
It's just everything is gone.
The short supply of water and low pressure impacting emergency services. Firefighters struggling Thursday to put out a large blaze at a San Antonio apartment complex.
We make some good headway, and then they run out of water.
Anger boiling over for many Texans.
I expect a full apology as to how this has been handled.
Governor Greg Abbott says he takes responsibility for the failure of the state's utilities.
Again, I find what has happened unacceptable.
And says changes will be made.
I want to ensure this never happens again.
In the meantime, Texans cling to an improving forecast and each other as they weather the crisis.
To news in sports now. Renowned track and field coach Stephen Francis says athletes' ability to compete overseas and return home for training will be hampered by the current COVID-19 travel restrictions on the island. Now, Francis is calling on the government to look into the issue as his athletes look to step up preparation for the Olympic Games. Jermaine Brown reports.
No local track and field meet has been held since the start of the year, despite the government on February 5 announcing a lifting of restrictions on the hosting of some sporting events on a case-by-case basis. Renowned track and field coach Steve Francis says he's now looking at overseas meets for his athletes as they look to intensify preparation for the Olympics and the 2021 season. But he says that this plan could be hampered by current COVID-19 restrictions, which will affect athletes' ability to train locally after returning home from overseas meets.
And certainly that they will find a mechanism to allow people on return to continue their training, because it is not. It is. I don't know if you could expect that an athlete, a very top athlete or athletes, are going to go abroad for medical treatment, then have to sit out training for 2 weeks, or go to compete and have to not train for 2 weeks. That's impossible.
The veteran coach, who currently guides the likes of reigning Olympic double sprint champion Elaine Thompson, says the matter is also urgent as, unlike last year, a busy 2021 international season is anticipated despite the COVID-19 pandemic.
So we know that there will be competition around the place, looking at the indoor season so far, which seems to be in full swing. So I expect that come March, April, May, June, July, August, September, the outdoor season will be going almost as normal, maybe without spectators, but without too much spectators. But, that's what I expect will be happening.
Francis also sought to put the COVID-19 protocols and restrictions into further perspective.
We knew that the most important thing is to establish as much social distance as possible, most days from people, and to wear masks. And we try very hard to enforce that. It's difficult among young people because they tend to be more to be bigger risk takers. But it's something which I think people are beginning to get used to.
Calls for the resumption of sports has intensified in recent weeks, with coaches, athletes and doctors weighing in on the matter. Jermaine Brown reporting for TVJ Sports.
And that's the Midday News. I'm Anthony Lugg. Join us at 7 for Primetime News. On behalf of the news, sports and production teams, good afternoon.